Macular degeneration is a common eye condition that affects millions of people around the world. You may have heard of it, or you may know someone who has it. But do you really know what it is, what causes it, how to spot it, and how to treat it? If not, don't worry. In this video, we will explain everything you need to know about macular degeneration. So without further ado, let's dive in. So, what is macular degeneration? Macular degeneration is a disease that damages the macula, which is the central part of your retina. Your retina is the thin layer of tissue at the back of your eye that captures light and sends signals to your brain. Your macula is responsible for your central vision, which allows you to see things directly in front of you, such as faces, words, colors, and details. When your macula gets damaged, your central vision becomes blurry, distorted, or dark. You may have trouble reading, recognizing faces, driving, or doing other tasks that require sharp vision. You may also notice changes in how you perceive colors. However, your peripheral vision, which is the ability to see things on the sides, usually remains intact. There are two types of macular degeneration: dry and wet. Dry macular degeneration is more common and less severe. It happens when tiny yellow deposits called drusen accumulate under your macula and cause it to thin and dry out. Wet macular degeneration is less common but more serious. It happens when abnormal blood vessels grow under your retina and leak fluid and blood. This can cause swelling, scarring, and permanent damage to your macula. So how do you know if you have macular degeneration? Well, the symptoms may not be obvious at first, especially if only one eye is affected. You may not notice any changes in your vision until the condition gets worse. Some of the early signs of macular degeneration are blurred vision, difficulty seeing in low light, problems with color perception, and straight lines appearing wavy or crooked. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. So now, what causes macular degeneration? The exact cause of macular degeneration is not known, but there are some factors that increase your risk of developing it. These include: number 1, age. Macular degeneration is more likely to occur as you get older. It usually affects people over 50 years old. Number 2, family history. Macular degeneration tends to run in families. If you have a close relative who has it, you are more likely to get it too. Number 3, race. Macular degeneration is more common among white people than other races. Number 4, smoking. Smoking damages your blood vessels and increases your risk of macular degeneration. Number 5, high blood pressure. High blood pressure puts stress on your blood vessels and can damage your retina. Number 6, high cholesterol. High cholesterol can clog your blood vessels and reduce blood flow to your retina. Number 7, obesity. Obesity increases inflammation and oxidative stress in your body, which can harm your retina. Number 8, cardiovascular diseases. Cardiovascular diseases, such as heart disease and stroke, can affect your blood circulation and oxygen delivery to your retina. Now let's get to the diagnosis. If you notice any changes in your vision or suspect you may have macular degeneration, you should see an eye doctor as soon as possible. Your eye doctor will review your medical and family history and conduct a comprehensive eye exam. Some of the tests they may use include: number 1, eye examination. Your eye doctor will use special instruments to look at the back of your eye after dilating your pupils with eye drops. They will check for signs of drusen, fluid, blood, or mottled appearance in your macula. Number 2, Ansler grid test. Your eye doctor will ask you to look at a grid with straight lines and tell them if any of the lines look wavy, broken, or distorted. This test can detect changes in your central vision caused by macular degeneration. Number 3, fluorescein angiography. Your eye doctor will inject a dye into a vein in your arm and take pictures of your eye as the dye travels through the blood vessels. This test can show if you have leaking or abnormal blood vessels in your retina. Number 4. Optical coherence tomography. This test uses light waves to create detailed images of your retina. It can measure the thickness and shape of your macula and detect any swelling or scarring. Number 5. Optical coherence tomography angiography. This test is a newer version of optical coherence tomography that can also show the blood flow in your retina. Now, how can you treat macular degeneration? Unfortunately, there is no cure for macular degeneration yet. However, there are some treatments that can help slow down the progression of the disease and preserve or improve your vision. Depending on the type and stage of macular degeneration you have, your eye doctor may recommend one or more of the following treatments. Number 1. Medications. There are some drugs that can help stop the growth and leakage of new blood vessels in wet macular degeneration. Your eye doctor will inject these drugs into your affected eye every 4 to 6 weeks. These drugs can help prevent further vision loss and may even improve your vision in some cases. Number 2. Laser therapy. There are 2 types of laser therapy that can be used to treat wet macular degeneration. One is called thermal laser therapy, which uses high-energy laser beams to destroy the abnormal blood vessels. The other is called photodynamic therapy, which uses a light-sensitive drug to damage the abnormal blood vessels, followed by a low-energy laser beam to seal them. Laser therapy can help reduce the leakage and bleeding in your retina, but it may also damage some healthy tissue and cause scarring or blind spots. Number 3. Vitamin supplements. There are some vitamin supplements that can help reduce the risk of vision loss in dry macular degeneration. These supplements are based on a formula called AREDS, which contains high doses of antioxidants and zinc. The latest version of the formula, called AREDS 2, also contains lutein and zeaxanthin, which are pigments that protect your macula from blue light. You should talk to your eye doctor before taking these supplements, as they may interact with other medications or have side effects. Number 4. Low vision rehabilitation. If you have significant vision loss from macular degeneration, you may benefit from low vision rehabilitation. This is a process that involves working with professionals such as optometrists, occupational therapists, counselors, and social workers to help you cope with your changing vision and improve your quality of life. You may learn how to use adaptive devices such as magnifiers, telescopes, electronic readers, or voice-activated software to help you with daily tasks such as reading, writing, cooking, or shopping. You may also get emotional support and guidance on how to deal with the psychological and social impact of vision loss. So, what can you do to prevent macular degeneration? While you cannot completely prevent macular degeneration, you can take some steps to lower your risk and protect your eyesight. These include: Number 1. Eating a healthy and balanced diet. To try and prevent macular degeneration, you should eat a diet that is rich in antioxidants, zinc, omega-3 fatty acids, and leafy green vegetables. These nutrients can help protect your retina from damage and inflammation. Number 2. Protecting your eyes from ultraviolet rays. Try to wear sunglasses and hats when outdoors. UV rays can harm your retina and increase your risk of macular degeneration. Number 3. Exercising regularly. Exercise improves blood circulation and oxygen delivery to your retina. Exercise can also help you maintain a healthy weight and lower your blood pressure and cholesterol levels. Number 4. Quitting smoking or avoiding secondhand smoke. Smoking damages your blood vessels and increases your risk of macular degeneration. Number 5. Visiting your eye doctor regularly for routine eye exams and screenings. Early detection and treatment of macular degeneration can help prevent or delay vision loss. At the end, remember that macular degeneration is not a death sentence for your vision. There are many options available to help you manage the condition and enjoy life to the fullest. Now, we want to hear from you. Do you or someone you know have macular degeneration? Did it significantly affect your quality of life? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.